today's Reframe Cancer Breast Cancer Awareness webinar. It is Breast Cancer Awareness Month, and breast cancer is sadly the most common type of cancer that somebody might actually experience. You'll all have heard of the statistic, 1 in 2 of us will experience cancer in our lifetime. This is one of the things that Reframe Cancer are absolute experts in, and we want to share with you today our expertise in that area, but also to bring in some of the other areas that are really valuable when it comes to actually thinking about cancer. And that's when it comes to things like protection insurance and the added value services that are available to patients. So I'm delighted to have a fantastic panel with me today. So I'm going to introduce them all. We really want your interaction too. So please do put your questions in the chat. We'll be looking at the chat throughout the session, and then we'll be posing your questions to our expert panel. You will hear from personal experiences as well as professional ones, and we really want you to take something away from this webinar, both personally and professionally, to try and help make sure that you're far more aware about the symptoms of breast cancer, but also what can be done to try and reduce the risks and make sure that you are better financially protected as well should the worst happen. So without further ado, I'm now going to introduce my panel. First off, I'd like to introduce Paula Coffey, who's Director of Claims at Unum. We've got Paul Roberts, who's Propositions Director at CI Experts. We've got Emily Ward, who's Business Partnerships Executive at the Insurance Surgery. We have Debbie Bonza, who's a protection expert in her field, but also a breast cancer claimant. And last but definitely not least, we've got Nikki Cannon, who's Head of Clinical Operations at Reframe. We're going to start off with Nikki. So Nikki's going to be talking about the breast cancer landscape, so to speak, the symptoms, the data, what you should be looking out for, and what you can do to try and reduce those risks yourself. Nikki, I'm going to hand over to you, if I may.
Thank you, Emma. I'm really pleased to be here. So Breast Cancer Awareness Month is such a crucial month to raise awareness and share and talk about people's experiences. Emma has warned me, apparently I don't have the whole hour, which I could easily take up, but I will be concise because there's an awful lot to talk about. It's a tiny bit about my background. I'm a cancer clinician by background. I worked in cancer screening and breast cancer for 10 years. As well as having a very significant family history and experience. So it's a subject really dear to my heart. As Emma said, we're going to have a really brief overview of how common breast cancer is, some of the risk factors and symptoms, and how important screening and early detection is, because it really makes a crucial difference. So breast cancer, along with all cancers, that the picture has changed over the years. I've been working in the cancer field for scarily over 30 years. And when I first started, we used to talk about 1 in 12 women would get breast cancer in their lifetime. And I remember being a student at the time and being quite shocked by that. Well, you'll see here now our incidence is 1 in 7, and it's gradually, incidence has crept up, which is a scary statistic, but balance that against the fact that actually survival and treatment has improved hugely, and the key indicator here being the earlier we detect a cancer, the far better an individual's chance of survival. But breast cancer is our most common cancer in the UK. Huge numbers of people are affected by it, as we're going to hear from today, and I'd be really surprised in the audience if you don't have a family or loved one or friend who has been impacted by breast cancer. Do you see there are nearly 57,000 people diagnosed each year. You can get breast cancer in males. That figure is around 390, 400, and interesting, that's quite a static figure. That hasn't changed, or the incidence of females has gone up. But breast cancer in men is something we shouldn't dismiss and be aware of. And actually, in my own personal life, I actually have 2 friends that have had male breast cancer, both doing really well. And also there is that increasing incidence, and an increasing incidence in younger women. We'll talk about screening in a little bit, but also we have our NHS cancer screening programs, which are fabulous and have a huge impact to the improved survival and early detection. But that doesn't kick in until somebody is 50. Well, we are seeing, sadly, increased incidence in younger women, which is something we need to be aware of, which makes that whole awareness piece more important. But as I say, the good news story is with improved treatments, over 70% of women will survive their breast cancer for more than 10 years. And actually, if you take the 5-year figure as well, it's almost 100%. If you pick a cancer up earlier, it's almost 100%. So breast cancer, although it can be really scary, treatment can be tough, it is absolutely survivable. And the earlier we detect it, the more chances your risk of your chance of survival is. Also, there's a lot we can do to protect ourselves and lower that risk. You can see there that we estimate that up to just over 30% of breast cancers can be prevented by making lifestyle changes. And I'll talk a little bit more about that in a couple of slides' time. That actually applies across all cancers. There's a lot we can do to protect ourselves. So it's a mixed picture. There is a rise in incidence, but also there's rising survival. That's a positive overall picture. But what are the risk factors? We need to be aware of them so we can identify them. And this is something that here at Reframe, we've been working really hard to help people to understand their personalised risk of cancer and what they can do to reduce that risk, and which may or may not include screening. So some risk factors are outside of your control. As with all cancers, the older you are, the more likely to get cancer. And sadly, we can't stop the aging process. But there are lifestyle factors which we can control and we can help to reduce our risk. So obviously being female is a risk factor, being older is a risk factor, having a family history. I sit here as someone who grandmother, mother, sister, cousin have all had breast cancer. I'm really lucky, in fact feel very fortunate that I'm part of the NHS high risk family screening. So I used to get an annual MRI and mammogram. Now I'm a bit older, I just get an annual mammogram. So family history is really important. I've been tested for the BRCA. A lot of people have heard of BRCA1 and BRCA2. If you have that gene fault, you have a significantly high risk of breast cancer. Interestingly, my family, we don't have the BRCA. What we've been told is there probably is a gene, we probably just haven't found it yet. So the whole world of genomics is really growing exponentially and holds an awful lot of promise for the future. We hear a lot about genes and breast cancer and genes cancer. So that's an area which is helping people again understand their personalised risk profile. Having dense breast tissues, and this is fairly new, and the NHS screening programme are looking how they can adapt to this. So it makes logical sense, doesn't it? If you're a woman with a really breast test, and younger women, especially premenopausal women, will have denser breasts, and it makes a mammogram less effective. Makes the X-ray just can't penetrate through dense breast tissue, and so it's more likely to hide those breast cancers. And they also now think that it's actually harder to pick them out. Actually, so those women can often develop a more advanced cancer before it's detected. Breast cancer is very hormone driven, so you can see there's lots of interaction here with both our periods and menopause. So if you start your period very early and you have a very late menopause, so you're hormonally active for a longer period of time, that can increase your risk of cancer. And it's why some of the panel will be very well aware, if you've had a breast cancer diagnosis and treatment, you're then given either tamoxifen or other hormone controlling drug, which kind of could really help to protect you from recurrence of cancer. So those things you can't change, but if you're aware about them, as with myself, you can make sure that you're being extra vigilant and making sure you're having that regular screening and awareness. But there are also factors that we can do something about. We know that obesity, so being overweight, we know that being physically inactive, drinking and even small amounts of alcohol, we know it increases the risk of breast cancer. Actually, I think it's 12 different cancers are affected by alcohol intake. Pregnancy history, again, so that's linking with the hormonal status. So women that have never had children, it's slightly higher risk, or women that even had children, a first child over the age of 35. Could be at higher risk. And also breastfeeding, there's an interaction there. If you've breastfed, that's protective. And again, picking up on the hormonal aspect there, contraceptive pills and HRT. I would really caution here, because there used to be an awful lot of fear around HRT and menopause. I think we've learned an awful lot about that over the last few years, and I'm really passionate around women's health. The risk of HRT is something that you need to really think about and balance, because the benefits can far outweigh the risk. HRT is protective of your heart, and each of these risk factors on their own actually contribute a very small amount of risk. I want to really balance kind of fear mongering, making everyone terrified, by educating and having a balanced approach to what your risk factors may be. So it's about understanding your risk profile, steps you can take to improve it, but really important along the bottom there, having a risk factor, the conundrum of cancer, having one of these risk factors does not mean you will definitely get cancer, but it helps you be aware, it helps you take the steps that you can take to reduce your risk. But there's no guarantee, which is why screening becomes so important to really, and also being breast aware. And I know Emma's going to pick up on that brilliantly for us. So these are just high level, some of the risk factors, some of the picture. And again, I just want to emphasize that where massive improvements have been made is in the treatment of breast cancer, so that we can pick it up early, we can treat it, get you back up on your feet and back to your normal life. Oh, I'm going to hand back to Emma. Do you want that slide now, or shall I hold on a second?
No, put the slide on. That's great. Thank you ever so much, Nikki. I'm also a breast cancer survivor like Debbie. And what I wanted to share with this webinar was this image is the one that I saw that actually helped me to identify that there was something wrong with me. We all get told, check for lumps, but as this really simple but powerful image shows, it's far more than just lumps that we need to be looking out for, and that is both men and women. So I saw this on Facebook. Social media comes in for a lot of bashing, and rightly so in some situations, but this actually potentially, whether it saved my life or not, but it certainly helped me get treatment sooner, because as soon as I saw this, I thought, one of those lemons is me. This is an image that's produced by the Know Your Lemons Foundation based out in the States. So some of you may have seen it on social media, but it's something that for me is really powerful. So yeah, I saw this, and then that prompted me to go and see my GP. And pretty much, cut very long story short, within three and a half weeks, I was told that, yeah, I had cancer, I had breast cancer. I had a stage 2 grade 3 tumour. And I was very fortunate to be able to have surgery really quickly, and I had protection insurance in place, which is why I work in this field. So that would have been very embarrassing had I not had insurances in place, given I've been talking about it for the last 20 odd years. But ultimately, I have gone through this experience myself. And obviously, anybody being told that they had cancer is a really traumatic time in lives. And we're going to be hearing more about Debbie's experience with it, who had a different situation from me. And that's the key thing as well. Everybody's journey, everyone's story is going to be different. And I know firsthand how important it is to have the right care in place, but also to make sure that you are financially protected as well, so that you're just focusing on trying to beat cancer rather than actually having to worry about paying your bills as well. So we'll get onto that a little bit later. But yeah, so if you haven't seen this image, we will be sharing these slides as well, by the way. You don't need to be taking photos or searching on the internet for it. But yeah, please look at it and share it with your loved ones and other people in your life, because it could actually just save a life by sharing that. So that's why I wanted to share that today. So thanks ever so much, Nikki. I'll pass back to you.
Thank you. And I'll just add, I talked about my family, that my cousin's breast cancer was a rash on her nipple that she'd been treated as eczema for a number of weeks before that was diagnosed. Yeah, that's, yeah, again, really important that we are aware of that. So thank you for that, Emma. Okay. I've already touched on this a number of times, the importance of screening early detection, and I make no apologies for really banging on about it, because the difference is just astonishing. You can see there, it's really stark. As I said, at stage 1, pretty much 100% women will survive 5 years or more, and that's the in clinical world we talk about survival. We never talk about cure, we talk about survival stages, and 5 years is that kind of marker of actually moving towards full survival. Stage 2, you'll see there, it's 90%. Then when we get to stage 4, the reduction is huge. It's 25%. The difference is just astonishing. And this is breast cancer we're talking about today, but it's also the same for bowel cancer. And it's one of the reasons why we have national screening programs for these cancers, because we know when we pick them up earlier, we can make a huge amount of difference. So that's really key to understand. Oh, apologies. And you can see there, screening works. Almost 80% of cancers diagnosed via screening are at that earlier stage. And we do have, so I worked in the NHS cancer screening for a long time. It has expanded. It used to be 55, not 56. It has come down to the age of 50 every 3 years. And that is really effective. And it's picking up an awful lot of cancers earlier. But we also know clinically, very nice guidance, and referring earlier when younger women are becoming diagnosed with cancer, that there is benefit, is a radiological intervention, a mammogram. So there are guardrails you need to put in place. But from the age of 40, we know there's a benefit to having a mammogram every 2 years. You can't have more than one a year because of that radiological dose. So I get manually because of my high risk, but every 2 years from the age of 40 we know you can see a significant increase in detection, balancing that risk. But with the NHS screening, once you hit 50, people are invited by regional cohorts. You'll often see the big mobile screening vans. They'll be parked in a Sainsbury's car park. So you'll get invited in batches. Some women won't get it on their 50th birthday. It might be nearer to 53, and I know that makes some people anxious. And you'll be invited once every 3 years. So it is a great program. Again, we know uptake nationally, and I worked across breast screening across the whole of London, and uptake would vary from the national target was 75%, and would vary from around about that to less than 25% in some areas. And there's lots of reasons why that could be for underlying fear of screening, and I think of fear of cancer, and people not realising the positive impact of that survival. So it's another reason why here at Reframe Cancer we've been really pleased to work alongside, promote, enhance the NHS screening offer, but also be able to expand on that. So hugely important, and really recommend that. And again, employers, encourage your employees and staff, you've got that screening appointment, yes, you can have a couple of hours off to go and attend your screening, because it's really important we do try and promote that. The difference is huge. And I think that is my slides, Emma, unless there's any questions.
Thank you, Nikki. Yeah, I think one of the key reasons why Reframe has developed its own screening program, I got diagnosed at 43 before I would have had the eligibility and that letter through the post. But yeah, the key thing is, if you are invited to go for a screening for whatever type of cancer, please go, because it can make a world of difference. And certainly getting on board with other screening access like Reframes can make a hugely positive difference to people as well, because sadly too many people do get diagnosed far sooner than they might anticipate getting diagnosed. So thank you so much, Nikki, for sharing that. Nikki, if you just want to share the last slide just really quickly, we can absolutely go into far more detail about what is available. So if then you can get in touch with Abdul, he'll be happy to take you through a demo. As I said, we will share these slides, so you will have Abdul's details at the end. But yes, so you can absolutely find out how Reframe could be helping you, your colleagues, and your clients. I'm going to now go to Paula. So Paula, as I said, is Director of Claims at Unum. Unum are a insurer who provides employee benefits, group schemes, life, critical illness and income protection. So Paula, being in the claims space, that is hugely important. That's ultimately why insurance exists, so that people can claim. Nikki, can you stop sharing your screen just for 1 second? Sorry. Thank you very much. Thank you. So yeah, it's all about the claim. So when somebody does get diagnosed with breast cancer or cancer in general, how can Unum help? What are they doing to actually support those claimants?
Thank you, Emma. So from my perspective, when somebody tells us that they or their employee has been diagnosed with breast cancer, or any other cancer for that matter, the most important thing is to make sure right from the beginning that they don't feel like they're just a person calling a number. That person is going through something which is a life-changing moment. So every conversation that we have with them deserves to be treated in that way. So of course, every experience is different too. So we always start by asking ourselves right from the beginning, what does this person need from us right now? Sometimes we hear about diagnosis early because the employer has reached out to us. And at that point, one of our clinical team, someone who really understands cancer and the treatment journey, will speak to that person directly. They'll talk to them about what's ahead, what might be difficult, and what kind of support could really make a difference to them. That support might be something that we can offer directly, but also it might be something that we're pointing them to another service that they've got access to, like private medical insurance, for example. It's really about spending the time with that individual to reassure them early on that they're not navigating a very complex situation just by themselves. Other times we're contacted at the point of claim, so when a claim has been submitted to us, and in those cases we'll quickly connect that person to somebody in our clinical nurse specialist team within the department. They'll then take some time to understand not just the medical side of things, but also how cancer is really affecting them and their lives. So that could be anything from work to their family, or how they're coping from a mental health perspective. So the nurse's role is about seeing that whole picture and offering support that fits that person's situation at that time. And of course, as a director of claims, the financial side of things is really important too, but we shouldn't ignore that. We should just make sure that we make that really easy for the person. So when somebody's dealing with a diagnosis like breast cancer, the last thing they need to do is worry about money and having to chase their insurer on a regular basis. So we just see that as a bit of a transactional or hygiene factor. We just want to make that really smooth. It should just happen while the team are actually focusing on helping that individual emotionally and practically. that connection between the person and the team is so important. And it's just lovely to see. We've had people, after we've obviously supported them, reach out to us months after they finished their treatment, just to let their nurse know how they're doing. They don't have to contact us. They just want to share that moment and how happy they are with somebody who's been there with them as part of their journey. And when that happens, I think we've got this right. We've definitely done something right here. That makes me really proud that we've gone beyond the claim.
Absolutely, because yeah, insurers have historically really been there to provide that financial support. But over the years, we've seen a huge amount of development in terms of really focusing on that holistic support for claimants, haven't we? And obviously that's why you've partnered with Reframe.
Yeah, absolutely. So we work with Reframe. As soon as somebody lets us know that they've been diagnosed with cancer, we can connect them straight away with the option of speaking to a Reframe Cancer nurse specialist. Because like I said earlier, it's moments like that that are really important, that people know they've got a broader support team, both from Unum but also from the Reframe side. I remember a few years ago we worked with somebody together with Reframe to support a lady called Gemma who had a Unum policy. Gemma was a mum of two and she'd been diagnosed with breast cancer, and she was actually the first person at her company to have been diagnosed with anything like this and to utilise the services. And she wasn't sure what support was out there, or actually if reaching out to us was going to just add some additional work and complexity to her situation. But she did reach out to us, and she found that having somebody from Reframe as well as really made the world of difference to her. And actually the things that really helped Gemma was the practical stuff. It was stuff like getting childcare or getting to and from work every day. So when somebody's going through cancer treatment, support with the day-to-day stuff really makes a difference to them. I remember with Gemma in particular, there was a time that she got a letter about a scan that she wasn't expecting, and it threw her into a panic. She spiraled. She couldn't get through to the hospital. She didn't know what was happening. So she called the nurse at Reframe, and straight away the nurse was able to reassure her and show that she was there for her. She offered to call the hospital herself and be there until things were sorted. So it's that kind of support, knowing you've got somebody there in your corner if you need them. It's just a great example of how that partnership we have with Reframe works really well for our customers. And that's what we're all about at Unum too, just avoiding one size fits all and treating people individually based on their circumstances.
Absolutely. And for lots of people on the webinar, they may think that if the person's got private cover, they'll be fully supported. Now, I had private provision, which was great. That was really helpful to me, but there are still gaps. And there are still examples actually where going down the NHS route might actually be more advantageous for that person. And it's actually having that level of support that can direct you as to which treatment option is actually going to be the best one. And as you said, to be there to answer queries, because it's not always available either through your NHS provision or through your private medical insurance provider. Debbie, I'm going to come to you because you had, I say similar situations. So Debbie and I used to work with each other. Debbie got sadly diagnosed after I did. And Debbie's worked in this industry for many years, like I have too. But you had a bit of a different experience. And obviously you were also benefiting from protection insurance as well as private medical insurance, and obviously the NHS support too. Debbie, I'm going to hand over to you, and if you could share your story, that would be brilliant. Thank you.
Yeah, okay. Thanks, Emma. Good morning, everybody, and thanks for giving me the opportunity to share this with you. So yeah, everybody's different, and it was November 2020, and something didn't feel right. It wasn't a lump as such, just a change in how my left breast felt. Emma, you'd shared your Know Your Lemons on Facebook, and I'd had a look at it and I thought, need to do something about this. So I went to the GP. The GP said, I don't think it's anything to worry about, but if you want me to send you for a mammogram, I will do. There was a 2-week wait list, maximum 2 weeks wait list. And she said, let's send you off to be sure. At that point, I did say to her, I've got private medical insurance. Is there any benefit to me using that? And she said, no, you'll be seen just as quick on the NHS. I don't think you need to do that. So I followed that route. So fast forward 2 weeks, I had my mammogram at Leighton Hospital here in Cheshire. But then after I'd had my mammogram, they then ushered me into another room for a different kind of scan, which was an ultrasound scan. And then she said to me, don't worry, I'm just going to use this needle to do a biopsy. And this needle was huge, quite scary. And I wasn't expecting it. So it took me by surprise that I was going down a bit of a rabbit hole at that point. Everything started happening really quickly. That's how it felt at the time. She'd seen something she didn't like, so she wanted to do this biopsy. And that kind of made me worry, as it would. 4 days later, I went back to see a registrar consultant only to be told that the results were inconclusive and that I would have to have them redone together with a biopsy on my lymph nodes as well. Obviously disappointed because I just didn't know where I was up to with everything. So in the middle of COVID, just coming up to Christmas, the earliest they could see me was January the 5th. We'd got a family holiday to France planned for Christmas, had to cancel that. And I think Boris put us all on lockdown as well. It was just a case of sitting and waiting in our little bubble for the 5th of January to come around. Up to this point, I'd had no contact from Macmillan. My employer knew what was happening. I'd kept in touch with work, but I'd not had any external support from anybody. So listening to the services that Paula and Nick have mentioned, that's different now to how it would have been back then. And I felt very much on my own at the time. So 6 weeks had passed since I saw my GP, and it was just getting very distressing because I wasn't really moving any further forward. The new year came and I had the second biopsy and the lymph node biopsy. I had been on, going back to Nikki's slides before, I had been on HRT and I'd also got a progesterone coil for contraception, and I had to have that removed and come off the HRT immediately. So you can imagine my hormones were all over the shop. Mess I was. It wasn't great. Anyway, 11th of January was the results day. And thankfully, despite it being COVID, husband Richard was allowed in with me. And after a very long wait in a very sparsely decorated room, Emma's got a story about her room that she was invited into. Mine was completely different. I had very hard plastic chairs and no decoration. We were told by a consultant who was accompanied by a Macmillan nurse, so I knew it was bad news when the pair of them came in, that I had something called high-grade ductal carcinoma in situ. Okay. They said, it's good news. Wasn't really. Their words, it's not real cancer because it's a stage 0. Okay. But we will still treat it the same way that we would treat normal cancer. So my head was completely fried at this point, as you can imagine. In that appointment, I was given 3 options to go away and consider. I would need surgery, I would need radiotherapy, and I would need hormone therapy for at least 5 years. But the 3 surgery options that I was given was, number 1, a full mastectomy where they remove the whole breast tissue. Number 2 was a lumpectomy, which was the removal of a diseased tissue. Now, family history, I've been tested for the BRCA gene, not got the BRCA gene. My sister had a mastectomy, my mum had a lumpectomy. So I think we've probably got that gene that's floating around that they haven't identified yet. The third option for surgery was something called LICAT surgery, which is the removal of the diseased tissue and reconstruction. So they take tissue from under your arm and flip it around like a chicken fillet to fill your boob so that you look fairly normal when you're finished. And that to me was what I wanted. It sold me on it. Okay. So a week later, I go back to say, yes, I want to go for option 3, the LICAT surgery. And he turned around and said, I'm sorry, but due to COVID, option 3 has been removed from the table. So you can only have the option of a lumpectomy or a mastectomy. Exit the hospital, floods of tears. And it was at that point that I decided to go and get a second opinion. Okay, all the way through this, my mantra has been, if it doesn't feel right, do something about it, challenge it. So I spoke to my insurance company and I went for a second opinion. And I was very fortunate to be able to see somebody the very next day. And I saw a lady called Emma D'Souza at the Alexandra Hospital in Cheadle. And I have to say that from that point forwards, everything seemed to fall into place. I was very fortunate to have full cancer cover under my private medical insurance provided by my employer at the time. So I switched my care from the NHS consultant to the private consultant. And although I I no longer had access to the Macmillan team at Leighton because they said, if you're not with us, then we can't support you. I did find support in other places, but I had to look for it. It didn't come to me, sort of thing. So you really do need a helping hand. And but from what I hear from Reframe and Unum, that's there now, whereas it wasn't 4 years ago. So I had 2 surgeries. One was on Valentine's Day to remove the nasty tissue and temporarily sew me back up, fill me up with a water-filled boob for a couple of weeks while they did the histology. Okay, histology results came back a week later, and here's the big thing. It turns out it wasn't just DCIS at all. I actually had stage 2 invasive cancer in there as well, and they didn't get it all out. I consider myself very lucky that they found it, because it could have been very different. It might not have come to light if I'd have gone for the lumpectomy option. So I do consider myself very lucky. So then what they did on St. Patrick's Day, so it's All Saints Days, I had my LICAP reconstruction and they took away the remainder of the diseased tissue and clear margins and everything. I ended up with a beautiful new boob and excellent results, very thankful and cancer-free. Following on from that, I had 15 sessions of radiotherapy at the Christie Hospital. And in the middle of that, the good news was that we gained a new grandson. So all was not that bad. Okay. But having said that, it wasn't an easy time. I did have 7 months off work, which thankfully was paid leave because my employer also provided income protection insurance as well as the PMI. And between the 2 insurers, they did help me return to work. So when it was time for me to get back to work, I was supported with a return to work programme by both providers. So in summary, for me, the combination of those 2 benefits meant that I could really take the right amount of time off work so that I could get the best possible treatment. It wasn't just about surgery, radiotherapy and hormone therapy. It was about having additional benefits such as physiotherapy, mental health counselling. I attended group sessions where we talked about how you adjust to living with a different body, because your body does change and it's never going to be the same as it was before, how that impacts your relationships and so on and so forth. We did yoga, fitness, nutrition. I had genetic testing covered as part of the benefit. I also had advice on how to do my hair and makeup. I didn't lose my hair, thankfully, but for a lot of ladies, that's really important. So there's many things that you wouldn't have thought about. What would have been better, though, was if I'd had somebody from the very start giving me a guiding hand, but I didn't. I had to navigate my own way through. I hope this little bit has helped you. I hope you don't need to use it in the future, but if you ever do, or if you ever know anybody, I hope this has helped. Thank you.
Thanks ever so much, Debbie. And I think that just illustrates that, yeah, we do have the NHS, and for a lot of people, it absolutely serves in every way that's needed, but for a lot, it doesn't. And this is where there are gaps to fill, and things don't always go right. And even going privately, things don't always go right. My surgeon was absolutely amazing. My oncologist was not great at all. And to have somebody supporting me as well through that and knowing how to cope with him would have been really helpful. So yeah, it's a real mix depending on whether you are going private or through the NHS, and there are pros and cons to both. But most importantly, definitely look at what you've got through your employer and look at what you've got through private provision as well, and try and maximise every single service that you possibly can do, because it's not just about the money, it is about all the other supports that you can access. So we have talked about, obviously, you know, that for a lot of people, they do have provision through their employer, but not everybody does. And even if you do have provision through your employer, you still might want to actually self-insure as well, to top up the cover that you've got, to be more in control of the cover that you've got, so that if for some reason you change jobs, you've still got that cover that's going to transition with you. And that's certainly what I've had a mix of as well, and I know Debbie did too. But if you are out there looking for cover for yourself, the products can be very different, and they have been evolving over time as well. Coverage has been improving. So Paul, you're an absolute expert in this field. You work for a company that actually helps advisors every day source the right products for their clients. So Paul, if you sort of kind of give a bit of a high level overview about what sort of things that people should be looking out for, and if you're an advisor on the call as well, things that you should be considering when you're advising clients.
Emma, thanks very much, and thanks everybody for sharing this. Debbie, I've known Emma and Debbie for a long time, and tremendous courage to come onto a programme such as this and share in so much detail. And I think for those employers out there that have an existing scheme in place that does cover critical illness in some way, then it's a tremendously important, valuable employee benefit, as you've just experienced. For those that you haven't, perhaps that's something to reflect on for the future. But from a personal perspective, the whole concept of having a self-insurance plan, if you like, against a group scheme is that the risk is considered on the individual. And in a group scheme, obviously the group risk is shared across the whole of the pool of everybody within that organisation. Having covered by yourself is important, and it's based on you. So critical illness, just as part of this, or serious illness, was introduced into the United Kingdom in 1986. And for a period of time, full cancers would be claims for full payment of that type of plan. And if you were to make a claim, that plan would stop. So it would pay out the claim linked to the cancer that you had, and the full condition would be paid out and the plan would stop. In 2003, there was a change in the ABI wordings. Now, they are the overseer, if you like, of conditions within personal plans. And a company called Scandia, who don't exist anymore, they're part of they don't exist anymore. They introduced an additional payment condition for breast cancer and low-grade breast cancer and prostate cancer in July 2003. And for the first time, that allowed cover to be put in place on an individual basis for the more serious cancers, but also for the lower grade cancers. The difference being that if you had a low-grade cancer, breast cancer, it would pay an additional payment in addition to the full cover. So over time, when that was first introduced, that payment level was relatively low. It was the lower of 10,000 or 20% of the cover at the time. That's over time has now increased up to the maximum levels you can get today are in the range of 50% of the cover, or £50,000. So these are quite substantial amounts of money. But the key thing of the lower grade cancer is that it doesn't stop the plan for the main conditions, the cancer, heart attacks and strokes that are also covered. So it's a complementary one. So very much runs alongside any group scheme you may have, any PMI scheme or any other thing you have. And all of these are complementary covers that you put into place. The key thing I think to remember is that not all plans are the same. And this is where speaking to a financial advisor becomes so important for everybody, so they can, if you have one, speak to them about the cover you have in place yourself already. If you don't have one, the recommendation would be to find one who can give you the levels of advice. And even if you just need to check the policies you have yourselves at the moment, the level of cover that you have will be explained within the policy documents. Insurers call low-grade cancer lots of different things, and even within CI Expert, there are, just looking quickly, 12 different variations of the same things in your policy wordings that you may have. So it's important to consider what you have in place, who you bought it from, how you sourced any cover you had, and in the future where you would get some from. And I'll just give an example here, is that almost every intermediated protection plan with critical illness in, that's something that you'd seek from a financial advisor, would have some form of cover for both full cancer and for low grade cancers. They're called additional payments, and they vary depending on the type of plan that would be bought between what we would call a core plan, which is a slightly less comprehensive plan, against the enhanced plans. If you were to have or were to buy a critical illness plan from a price comparison website or a source outside a financial advisor, it's extremely unlikely that plan would contain the additional payments for the low grade cancer. It would almost certainly contain the full grade serious cancer levels, but it's unlikely that it would contain the additional payments for the lower grade cancers. So when you're considering what type of plan you have and where you source that from, whether that's from a personal perspective or even from an employer's perspective, is to make sure that you check out the wordings of the conditions within that plan to make sure your expectations of what you are having meets the expectations of what are contained within the plans are available. And these vary across all the different insurers. And for advisors out there who use the CI Expert platform to help them make the right decisions, all this information is contained. So my summary on all of that, and thank you for allowing me to join you today, is to make sure that those people out there who don't have any form of critical illness plan consider having one in the future. If you are to look to buy one, to seek that advice from a financial advisor, and to consider all the implications of the details within the plans that you may or may not have, to make sure the cancers that are of concern to you are covered by the plan, to make sure that if you ever need to make a claim in the same way that Emma and Debbie have had to do in the past, that the plans that you have in place will provide you with the cover for the condition you have. But also, as Debbie mentioned, the health and wellbeing services that support modern day protection plans, the ability to have a second medical opinion, the access to GP, the support for health and wellbeing, physiotherapy, everything that's Debbie's covered, these are available as a non-additional costed benefit in many cases within modern day protection plans. Again, that's an important consideration that anybody should have when they are looking to have one, or to change one, or to buy one, or to look at what they've got, Emma. So that's, I guess, my final summary would be: speak to a financial advisor to make sure that any personal plan that you have meets the expectations you have from it.
Absolutely. And there are, within the critical illness market, there are so many different types of products, but also for income protection products, which effectively is your own personal sick pay cover. That has a huge number of, and Paula will know this from the income protection that Unum provides through employer clients. Cancer makes up a huge number of income protection claims, because obviously it is something that is significantly going to stop a lot of people from being able to work. And that's where claims teams, whether it's on an individual insurer side or a group side, can make such a difference in terms of actually helping people remain in work and get back to work where they can do. Paul, I don't know if you want to add anything to that. And obviously the Reframe team of nurses also provide that support too, but certainly something that insurers are really committed to on the income protection side, isn't it?
Yes, it's absolutely that, Emma. Across all of our products, actually, it's the most common cause. It continues to be the most common cause for claim. Often people have a myth that you should submit the claim and then we can help when somebody's ready to go back to work, but you mentioned already, sometimes it's to help that individual stay at work, and that's really important. So if somebody is going through that treatment, they might want to choose to work part-time, and we can support them with that, and however that looks, but ensure they're also taking time to look after themselves and really think about conditioning and the importance that as they go through their treatment plan.
Absolutely.
And if I can just come in on that, on personal income protection plans, of course, you can make multiple claims off a personal income protection plan. So it doesn't matter how many occurrences you may have of a cancer, providing the income protection plan is enforced, you can claim off that multiple times. So it gives you that extra layer of support, if necessary, to help you through all the future challenges that you might have.
Absolutely. And contacting your insurer as early as possible as well. Yeah, that's really key. Even if you're not in a position where for income protection, you will have to wait for a certain period before you can actually receive the money, but you still may be able to access some of the services that we've been talking about today, whether that's cancer related, or you're claiming for a problem with your heart or a stroke or anything like that. Just get in touch as early as possible, have a look to see what you're entitled to, because there could be added services that could be making a really big difference to you, your treatment plans, your recovery, and then obviously the financial support will be there when you need it. We'll have some people on the call though that have actually got an experience of breast cancer themselves and maybe thinking, do you know what, I didn't have any insurance in place. What can I now do? Am I uninsurable? Can I now access it? Or my sister had breast cancer. Does that mean that I can't take out insurance? So Emily, you work for the Insurance Surgery, a firm of financial advisors specialising in actually helping people access insurance who have actually got medical disclosures to share. What options are available, Emily, for people that have got a breast cancer disclosure to share?
So it depends on, there's different products within the industry, and I don't want to get too technical really, but there's like life insurance, critical illness cover, income protection. And basically, like your critical illness cover will generally pay out if you're diagnosed with an illness, but an illness that you're expected to recover from. And there are different depths within that cover. of sort of what stages and grades will be covered with different providers, and there's different levels within different providers as well. And then your income protection is essentially just private sick pay. So depending on if you've previously had breast cancer yourself, then you can have life insurance with no exclusions, really. You can even get it on standard rates after a certain amount of time has passed, which basically means that you are given the same price as somebody who's never had a medical condition. With the income protection and the critical illness cover, you can still have those covers, but it is going to have an exclusion on it, but it will only exclude the cancer that you've previously had. All other cancers going forward are still included within your cover. And then for people who've had a family history of breast cancer, all products are available to you without exclusions. So we can, even if you have an increased risk of getting that condition, we are still able to cover you with no exclusions on the policy at all.
So the key thing is really just obviously to, one, share everything that you possibly can about your own personal situation or the family history, so that the advisor can actually make sure that they're getting the right policy for you, because different insurers do have different stances, don't they?
They do. And I think it's important as well, because when you're in the finance industry, it's so easy to talk about things that people who aren't in the finance industry might not understand, and it might feel a little bit overwhelming. Whereas if we just speak with you directly, we can find out some more information about you and then just come back to you with the best options for yourself. So you don't have to have that knowledge, really, that can just sort of be a little bit overwhelming sometimes.
And one of the things that Paul touched on earlier is if you've already got a policy in place. Now, one of the things that I was very thankful for is 6 months before my diagnosis, I changed jobs. And that prompted me to actually think, what cover do I actually need now? Because I was changing jobs. I was actually going to lose my employee benefits. I had private medical insurance through my employer. I had sick pay through my employer. And moving jobs meant that during your probation period, you often don't get all those same level of benefits. Yeah. So I thankfully reviewed my own personal insurance, made sure that I filled in the gaps of the things that I was losing, but also just thinking, I'm older, I'd moved house, my circumstances have changed since I'd first taken out insurances, and the market has changed as well, as Paul was alluding to too. So definitely it's worthwhile reviewing your cover periodically, and whether that's going, even just getting out your own policy conditions documents and just go, when did I take this out? Because if it was more than a few years ago, chances are it may be worthwhile having a conversation with an advisor and just looking at how much cover do you need? Are you still with the same partner? Are your children grown up? Have you had more kids? Have you changed jobs? All of those things are really important.
Just chip into that.
Yes, sorry. Debbie, we've lost you. Sorry. We've lost your video, but we can hear you.
I went into a black hole. Yeah, I had to come back in again.
Okay, you're back.
What I want to say is that when I claimed I had personal critical illness cover, and when I was first diagnosed with the DCIS, that wasn't a valid claim on the policy that I had. Now, I'd taken the cover out 30 years ago. It was an old Swiss Life policy, one of the very first policies that were ever available in the market when Scandia were knocking about. And I never upgraded that cover. And so my first diagnosis of DCIS was no, it's not an eligible claim. But then as soon as it was upgraded to a stage 2 invasive cancer, then it became a valid claim. So that I had £30,000 worth of cover in that policy, and it did make a huge difference to us at the time, but it was the difference between not being covered and being covered. And had I been a little bit more savvy, I would have updated my cover. But I had family history issues with my mum and my sister, a few different variables there, but it was the difference between getting paid out and not. I just wanted to share that.
Thanks, Debbie. Emily, I think you were going to say something as well.
So I was just going to say, when you were talking about the changes in circumstances, I think moving house is quite a big one as well. I think you mentioned, obviously, children growing older, potentially growing family, change of partner, change of job, and change of house. Any of those sort of circumstances that affect your finances probably is worth reviewing your protection for, just to make sure that you do have sufficient cover.
Absolutely. Nikki, all the things that you've been hearing, obviously Debbie shared her story. From a clinical point of view, is there anything that you can add in terms of what other people should be looking out for, really? And I'm sure you must have had lots of patients come to you with similar experiences to Debbie.
Yeah, thank you. And it's been really, thank you for sharing your stories, because I think they're really powerful. I recognise a lot of the aspects of what you shared, and a couple of things that I've written down that have really struck with me is, as you said, that both of you and Debbie, around going with your gut if something is not right, and it can be difficult to navigate the system, whether it's NHS or private. And obviously I've been learning an awful lot about the insurance industry over the past couple of years. I've been at Reframe, and even that needs navigating. And I think it's asking questions, it's not being passive, which can be really hard, especially if you're quite scared of what the answers might be, because as we've heard, that time makes a huge difference. And I think something you said, Debbie, that really struck me, that support you need, the Macmillan nurse. And I've worked for Macmillan myself for 7 years, and I know what a difference it makes to have that support, but it isn't always there, sadly. And if you have to go looking for that support, that's quite difficult. And I think it's great that a lot of these policies have support such as Reframe built into them. Even if you're having great clinical treatment, with surgery, radiotherapy, chemotherapy, that support for everything else around your life, especially if you're working, especially if you're a young woman, maybe with children, maybe with family, all of that can become massively overwhelming. We call that kind of holistic supportive care is absolutely key. So yeah, I just think, lots of what I've heard today, I recognise. There are the realities of the stress and the capacity of the NHS. It doesn't always get it right. People do have bad experiences, but don't accept them. And that can be a difficult thing to do, to speak out, but I would strongly recommend that. And yeah, look at where the whole of the support that you can access is and try and tap into that.
Absolutely. And also, you may have, for those of you that have got protection insurances, you may not be claiming on something. So you may, for example, have an income protection policy that might not pay out for a whole year, but you're diagnosed now. That policy may still have these added services on top. So even if you've not any intention of claiming at this present moment in time, as I said, still worthwhile calling the insurer, because one, they themselves, the claims team there, might actually be able to provide support. But two, you might be able to tap into some of the added value services. And also, your partner might have a policy that would also cover you in terms of the added support as well, because a lot of insurances, and I know that obviously that's something, it's not just the policy holder, it is actually the wider family as well that could be benefiting either from just getting advice or actually having some practical support too, isn't it the case, Paula?
Emma, just on that point, many people watching today will have a plan that they share with a partner or a husband or a wife.
Yeah.
Of course, if they share a policy and you make a claim off the full payment condition, that plan will stop for both of you, not just for one person. So if you do have a plan at the moment you share with somebody else, it might be also worth speaking to a financial advisor to see if it would be in your best interest to have one each. So that plan isn't shared, and the benefits are huge of doing so. But that's where the important role of the financial advisor does come in, to be able to identify whether that's the right thing for you. And in many cases, almost every case, if you share something with a partner, it's going to be in both your best interests not to do that in the future and to have one each.
Absolutely. And it is that balance about getting, I said, having a look to see what you've got, having a look to see whether you've got a policy through your employer like Unum offers, and then speaking to a financial advisor to work out what else you should be taking out on top to make sure that you are fully protected, both you and your partner. So Paul, I was also asking you just about that wider coverage, because that's really important, isn't it, to policyholders? And a lot of people sometimes don't realise what they've got, what they're entitled to.
No, correct. And if you
Sorry.
Oh, so Paula.
Yeah. You're absolutely right, Emma. If it was me personally, I would be calling my husband's a check on my own, because there's things that can complement each other. And I think somebody said it earlier, just find out everything you could possibly access, ensure that you're getting the best possible support. I think people have so much to do, they just see that as admin, but it's worthwhile admin. It's worthwhile putting the time, effort and energy into it, because it's going to give you a more supported and better outcome.
Absolutely. And just using my own experience, I was lucky, like Debbie, I had access to a second medical opinion, not because I didn't trust my surgeon, but I just thought I've got it, so I might as well use it. So I used that I had access to on my critical illness cover. I was recommended to have the BRCA test done. I've got a mum and sister, and I wanted to see whether they were at a high risk and whether there was a high risk of me having secondary cancer as well. And I was recommended to have it, but then I called my private medical insurer to say, would you pay for it? And they did. So it just goes to show that you can get different coverage through different schemes that can work together to benefit you at the time that you really do need it. I can't believe we're at midday. It's 12 o'clock. We've been talking for an hour. I just wanted to say thank you to our speakers for sharing your personal stories, your professional stories, and your expertise across a whole range of different topics related to breast cancer. We do really want to make sure that more people are aware of the symptoms so that they can get diagnosed early. As Nikki really highlighted, that early diagnosis can make a massive difference in terms of survival rates and the treatment that you're actually going to have. So if you want to find out more about what Reframe could be offering you, your clients, your colleagues, your employees, please do get in touch with us. Definitely find out what insurances you've got through your employer. Find out what perhaps you might be paying for that you took out ages ago that you haven't actually remembered what you've got. So just make sure that you are aware about what you can claim on, and speak to an advisor as well who'll be able to give you, in a lot of cases, free advice to actually work out what's going to be the best option for you and your loved ones going forward. So I hope you found this helpful. This is going to be recorded. This has been recorded, so it will be shared with you. We will be sharing the slides as well. And if there's anything more that we can be doing to help you when it comes to cancer care, please do get in touch. But thank you ever so much for joining us today. Thank you.
Thanks, everybody.
Thank you.
Bye now.
Bye.